Good afternoon, everyone, and thank you once again for attending this December 3rd Leadership Public Conference. I want to first of all start by saying thank you to each and every one of you who've played an important part in helping us to communicate the message. I am asking that each of us continue to listen to what we have to say, because it is important that we understand the message, because the message is what we all need to do to continue to support this community. I had the privilege of joining Judge Floyd as well as Shane Plymell on a conference call on Tuesday evening with Dr. Hedersted and Dr. Zerwas, I'm sure I mispronounced their names. But it was a great conversation, and I think some of the comments that they made are important comments for us to repeat today. And one of them is the following, that certainly prevention is about behavior. It is about each of our behaviors. And behavior is obviously about what we believe or don't believe. We are so far down the road in terms of this communication about COVID, and yet we still have so many people who do not buy in to the fact that the COVID-19 exists, or that the things that we ask you to do that are the CDC guidelines are important to follow. But so far we've had in Tom Green County 105 deaths since the beginning or the middle of March. But what's most important to communicate is the fact that we've had 38 deaths in the past 10 days. 38 Tom Green County people have died with COVID-19 in the past 10 days. So our behavior, our belief, what we choose to do or choose not to do is very important for us. This COVID is about public health, and public health is about your behavior, and public health is about the economy. It's also about the well-being of our citizens from a mental or a financial perspective. Public health is about each and every one of us, and once again, it's about what we choose to do or not to do. The public has to trust us and trust the media and trust the communication that comes out, because it's what we have to use to make our decisions. And our decisions are based off of whether people believe in the honesty of what's being told to them. And we know that on an ongoing basis that what the media tells us and the information that comes out constantly changes. And so there tends to be a lack of belief because of the constant change. But remember, there's not been a playbook. There's not been a playbook from which any of us have been able to use, whether it's on a local level, a state level, or on a national level. We're doing the best we can with the best information we possibly have at any given point in time. Today we want to talk about the GA32, which is Governor Abbott's order that basically says the following: should a community reach a 15-day rolling or 15% hospitalizations on a 7-day rolling average, then we lose all ability to make the decisions, and that means that all of a sudden GA32 makes the decisions for us. I, Brenda Gunter, have never shut down the economy or shut down a business. It has never been in my hands to make those decisions, nor has it been in Steve Floyd, the county judge's ability to shut down a business. And it is not Dr. Vretis' decision to shut down a business. It is, in fact, the governor's decisions in terms of what we have to do, what we have to execute, and what we have to do to make our community follow, or it's what we will ask our community to do. But we are at that point. Shannon Hospital is doing absolutely everything that they can do so that we don't hit that 15%. And when I say Shannon Hospital is trying to do everything they can, they are doing the following. We do not believe that the hospital rooms that are showing and reflecting in the DSHS report is the correct number. If you follow the information that's out there today, you will see that we have had our 7-day capacity mark. But the numbers we believe are not correct, and we think the information that Shannon is providing to them today will in fact change that number, and we will be less than 15%. But really, that's not the message here today, because we can't keep adding more rooms, and we can't keep having Shane Plymell try to figure out what our room count is so that it doesn't impact us. What we must do and continue to do is to believe enough in our citizens, in our neighbors, in our family, to do what we ask you to do. Today we hear a lot about the new vaccines that are out there, but let me tell you what, most of us in this room will not have the privilege of having those vaccines available for each and every one of us till after the first of the year at some point. And that means the following: the mask is equal to a vaccine. It is the best thing you have next to a vaccine. And I know many of you hate wearing the mask. We've said this 1,000 times. I, too, don't like wearing the mask. But I believe the following: it's a small thing to ask. It is a small request. And it does not require wearing a mask 24/7. Those families who have been impacted over the past 10 days with those deaths, and some of you probably know those people. It's getting closer and closer to home. So this is a real pandemic. It's a real issue, and it's impacting our community. At this point, we are the only community that has not already had to fall under GA 32, meaning Midland, Odessa, Abilene, Lubbock, Amarillo, and El Paso have all had to react and follow GA 32. We are the only community out here right now who have not had to start following those orders. We believe in this economy. We believe in the importance of the local businesses. We believe that our local businesses are the heartbeat and the safety of this community. It is their lifeblood. It is our lifeblood. It is their family's lifeblood. And we, as citizens, need to do what we can do to secure the future of all of our businesses and the health of each of our citizens. Today, Judge Floyd is not with us, and I will read his comments. He says the following: "Please excuse my absence, but out of an abundance of caution, I am quarantining, I cannot say the word today, my apologies, it's not coming out right, due to a COVID exposure. First, my apologies for sharing information provided by the DSHS region that was either incorrect or has changed. Instead of the 7-day rolling average that has been applied to much of the data analysis, the criteria for determining the percentage of COVID patients hospitalized will follow Governor Abbott's GA 32, which states 7 consecutive days. I wish to thank our community partners, chiefly Shannon Health Systems, and our citizens for helping our community remain as open as allowed by law. The battle is not over, but winnable refocused efforts. Keep up your efforts. Thanks, Steve Floyd." I will now ask that Dr. Vretis please come forward and offer some comments.
Thank you, Mayor. Just going to go over a couple of the updates that we have both locally in the community and some new CDC guidelines. As far as locally, everybody knows that Shannon has really been upping their game. They've been increasing the number of COVID beds available throughout the downtown campus. It turned out that for a while, even with the increase, we still weren't able to handle the number of COVID patients that we were getting. And just this week, they were able to open a less acute COVID unit on the South Side campus, so we're able to actually transfer some of the people that we've had at the downtown campus to South Side, where they still need some care, but they don't need quite as much care as we give them at the downtown campus. And that frees up more beds for us. We actually had situation in the past couple of days where we're holding non-COVID patients in the emergency department because we didn't have a place to put them while we had some empty COVID beds. So now they've kind of backed a couple of those COVID beds have been made back into regular medical beds so we could decompress the emergency department. And the importance of this is, we've been telling you all along, this isn't just COVID patients that we worry about. If the hospital fills up with COVID, we can't handle medical patients. We can't handle trauma patients. So this is the importance of this. Even if you're not around anybody with COVID, you don't get it, none of your family members get it, you could still have your heart attack, you could still be in the car accidents. It's important that we keep the hospitals decompressed as much as possible. And Shannon's just been doing a great job. I'm quite pleasantly surprised by how well they've been doing. I really am. Second thing, there have been changes in the guidelines from the CDC as far as quarantine. Excuse me. You know that when you actually have COVID, you get placed into isolation. When you've been exposed to somebody with COVID, you get in quarantine, because people seem to use those terms interchangeably, and they're not interchangeable. So quarantine is you had an exposure. The CDC has been recommending 14 days of quarantine for somebody who's been exposed, and that's from your last exposure. So if my wife has COVID and I go home today, 14 days starts from today. If she's still in isolation tomorrow, I go home again tomorrow, 14 days restart. So that's kind of a pushback. It's 14 days from your last exposure. Well, the new recommendations are, if your health authority permits, which I'm going to, you could change that from 14 days to 10 days of isolation from your last exposure. This will buy people about 4 more days. In order to be released at 10 days, you have to have been symptom-free for the last 72 hours prior to that. Okay. There is a slight increase in risk. Obviously, if we let people out of quarantine earlier, there's a slight increased chance that they could spread the disease. But according to CDC, the numbers are fairly low. The CDC also says that you can test out of quarantine, which is the first time they've allowed this. So if you have an exposure, they're saying if you get a PCR test at least 5 days after exposure, up to 7 days after exposure, and that's negative, you could be released from isolation. We're not going to do that. And the reason we're not is the amount of paperwork that allows you to do that. We don't have the staff to do that. Somebody would actually have to check the test you have, when it was taken, when you're quarantined, and we don't have the resources to do that. That puts you up to a 15% chance that if you're released at 7 days that you could still spread COVID, and we don't really want that, especially as our numbers are continuing to climb. It could be that if our numbers go down, in a month from now, I'd be glad to review this, but I want to see our numbers go down before we review this.
Thank you, Mayor. Again, it's a privilege to be here and help San Angelo stay well. I just want to reiterate a few of my remarks from our last press conference. The data and the ratios that I'll provide are really similar to what they were 2 weeks ago. So as you know, in San Angelo ISD, we have approximately 14,500 students. Within that, we are very pleased, and I want to again thank our families that are sending their students and children to school, that 99%, according to contact tracing, of our quarantined or isolated students are receiving that or a direct contact from outside the school system. So 99% of those direct contacts are existing outside the school system for our children. Right now, we have around 1%, a little under 1% of our student body that is, again, quarantined or isolated due to COVID. On the staff side, we have about 4% of our staff. So if you take into account substitutes, all of our employees, that's about 2,600 individuals or staff members and employees. Out of that 2,600, we only have 4% that are, again, quarantined or isolated. So 96% of our staff is employed and currently working in our current environment. I'd be remiss if I didn't I want to highlight, I get to, have the privilege to provide some of these percentages to you, but the person behind the scenes in SAISD is Dr. Farah Gomez, that is certainly lifting our system up and working in close partnership multiple times a day with our local CDC, as well as TEA, the Texas Education Agency, which is under direct supervision of the Governor of Texas. So SAISD is operating under the guidelines from TEA, the Texas Education Agency, as well as our local CDC. So right now we're tracking well. The information I presented, we were very concerned Fridays. We discussed substitute teaching on Fridays, particularly problematic for us, and always has been, but with COVID-19 exposure, it's even increased. Right now, 3 weeks ago on a Friday, we were at a 57% substitute fill rate. According to what we have recently piloted is our virtual Fridays for grades 9 through 12. That's high school grades 9 through 12. When we piloted virtual Fridays, this would be the second one tomorrow, December 4th, and then, of course, the December 11th. We increased that to 82% fill rate. So we went from 57% fill rate to approximately 82% fill rate with our substitute teaching by going virtually for our grades 9 through 12. We kind of have a phased-in approach if needed. We know that transmission rates with our high school students are higher than the elementary grades. So if we needed to do a phased-in microclosure type situation, we would go virtually with high school first, then middle school, then at a last resort elementary. And again, I want to reiterate, we have absolutely no intention of closing our schools. As long as students are well, staff are well, and I think the percentages and the ratios that we mentioned indicate that the schoolhouse is still one of the safest places in our community besides your private homestead. So our schools are still one of the safest spots in our community for kids, and the numbers certainly confirm that. So we again want to thank the families for all that they're doing to help us during this endeavor, and we look forward to continued progress in our community. Our basic philosophy is live your life with modifications so that San Angelo can get well. So we're proud of the mask protocols that are in place because right now SAISD is a controlled environment, and I think the evidence supports that. So thank you for all you do, and thank you, Mayor, for continuing to hold these joint conferences. Oh, that one's yours.
I want to make sure that we reemphasize what GA 32 says, because there have been too many people who think that when we hit the 7-day consecutive or 7-day rolling number, which is still in debate whether it's consecutive or rolling, that the following happens. Two things happen. These are at 75% get reduced to 50%, and those bars who do not have the food bar new TABC license would be closed. No other business would be closed. Those are the only two actions allowed. And as Governor Abbott said very vocally a couple weeks ago while he was in Lubbock is, we will not be shutting down the economy. We will not be shutting down the majority of businesses. There's only two things that happen. Bars without TABC new licenses, which the majority have done so, and occupancies would be reduced. We also want to go out there and say the following, that our healthcare workers have done such a terrific job, but they're worn out, they're tired, they've been stressed at an unbelievable level when you think this has been going on since the middle of March, and here we are in December, and it has gotten more intense over the past few weeks. So I'm going to ask the following. I've made phone calls today to several of our grocery stores and asked for their support in putting together packages to deliver to Shannon Hospital. But for any of you who would like to, as an organization or a family, to do something for our healthcare workers, I am going to say the following, that they are asking for chapstick, drinks, snacks, cookies, and cards of encouragement. And should you want to reach out and do something great for our healthcare workers, we ask that you call the marketing department at Shannon, and that number is 657-5064. I just want to reiterate, I've gotten hold of the HEB folks and I've gotten hold of the Walmart folks, and they are all putting together packages and working to do something for our healthcare workers. We don't want to do a drive-by and a big display of support outside Shannon because we are trying to follow the social distancing, avoid large groups, etc. So I think the best we can do, each of you can help us get this accomplished, is by supporting something great for those healthcare workers. And again, chapstick, drinks, snacks, and cards of encouragement. So any classroom, any organization that would want to put together a great big card to say thank you to our healthcare workers, I think they would greatly appreciate it. At this point, I would like to open up this press conference for questions. Yes, please.
Hi, John Tufts, Angelo Standard Times. DSH currently, or at least yesterday, listed our staffed hospital bed count at 633. You've stated that Shannon has information that could increase that bed count. By how much? Do you know?
Well, let me say 2 days ago we were at 613, so we've gone up to 633. They believe that there's somewhere in the neighborhood of 70 hospital beds that have not been counted for whatever reasons, or the information has been input wrong. And when they say input wrong, there's many, many different classifications of hospital beds. And so somewhere in that we think we're losing some of the actual numbers. But what we say is the following: Shannon shouldn't be having to worry about the hospital beds, whether it's 612, 633, or 670, or 690. What we want to make sure we do is to prevent people from getting to the point where they have to take a hospital bed up. They're doing everything they can to come up with a bed count that continues to put us in, if you will, the safety zone of not having that 15%. But it's a challenge, and it has happened in other communities as well. There's, for whatever reasons, there's somebody besides Shannon inputting information, and there's many classifications of hospital beds. So with that said, we hope that the new information will either be updated today and reflected in tomorrow's numbers, and they have not given me what that number they hope to be, but Shane believes there's somewhere in the 70 room count that we're missing. Now, we gained 20 yesterday, so maybe that's 50, and so if that is true, then that we haven't hit that 15% number. But again, the numbers continue to escalate and stay strong, as you know, because we've stayed in the 102, 93, 86, 93 numbers pretty consecutively. So we do want that hospital bed count to go up, but let's just keep in mind what that stress level is on the hospitals. If they get to that much larger number, then we're going to be tasked with finding staff to take care of those hospital beds. And we've already received 30 nurses from the state of Texas, which has made a big difference and allowed us to increase the number of hospital beds because we had staffing for them. But remember, many communities are asking for staff. So we're not the only community out there asking for staff. So some of our ability to increase the numbers depends on the number of additional staff that we can get from the state of Texas.
As of yesterday, San Angelo hit day 5 of being consecutively above 15%. If Shannon submits that hospital beds have increased, will any officials try to contest that going past 15%?
Yes, we will. If we can prove up we have those hospital beds, we'll be able to that 15% are invalid. And we will start with a new number based off of the new beds. We are doing what we can to keep this economy strong. We're doing what we can to make sure our citizens have the ability to run a business at the capacity that they need to be financially stable. And we don't want any business to have to close their door. It is the worst thing that any of us would want for this community. It is not in my wish list of things that we need to have happen here. We need the hospital beds, but we need people to make sure they understand their part in helping us keep Shannon's hospital beds available for those who might need it. And we need to make sure that we keep our citizens healthy. Other questions or comments, either or?
Did you want to go, Joe?
Yeah, I'll go. I have questions for, sorry, Joe Hyde, Angelo. I have a question for Dr. Dethloff. A bunch of questions. All right. Don't worry, they're softballs. So what's not been iterated, or reiterated, if it hasn't even been iterated at all, has been how important it is to keep the schools open for our economy. Can you kind of talk to that and what other community leaders have told you as the leader of the largest school district in the area?
Absolutely. I think in some of my previous remarks, we talked about just our staff and being able to keep the campuses open so that our parents, who many work for Shannon, work for other health entities in our community, so they can keep going to their job on a daily basis. So I think if you look at our primary grades, our elementary grades, it's just imperative that the school doors stay open so that our workforce, our local economy can keep generating to provide health care for our entire community. So that's certainly one aspect, Joe.
Another piece of it is when you look at some of the smaller school districts like Christoval or Very Best, one of the things that the superintendents are telling us is the education through Zoom, or the remote education, is not as good, and/or they can't enforce classroom attendance as well. And so, like for example, Paint Rock, I believe, just said they eliminated. They went to District 15. There were a lot of people there that was relayed to us that other smaller school districts are saying we'll get rid of it. How is the remote learning at San Angelo ISD different from what these smaller school districts are seeing?
I think early on, one thing that we did well, and sometimes you stumble into doing things well, is early on we had our virtual learning academy. So we established this before many school districts across the state did, and we use a platform called Edgenuity. Now, in all honesty, parents will tell you that is really rough and really hard, and it is. So the Edgenuity platform is very robust, it's research-based, and it's tough. So many of our virtual learners are in our Virtual Learning Academy, which I think started off maybe at 1,500 to 2,000 students is kind of where it is now, are utilizing that Edgenuity platform. So these are with teachers on the video, and then we have digital support teachers that are helping them. So I think one thing San Angelo ISD did really well is we did not put two different platforms on the backs of our teachers. So if you look across the state, many school districts, they're asking their teachers to run a virtual platform and run an in-person platform. In San Angelo ISD, our virtual platform we purchased, which is Edgenuity. So it has videos of teachers across the nation, and then we just have digital support specialists because let's say we had 5 teachers in 3rd grade. Well, because our numbers are reduced because of virtual, now we can take one of those 3rd grade teachers from last year, make them a digital support teacher. So they're in there just helping and supporting students that need it, kind of giving that hands-on support for this digital platform that's Edgenuity. So we did that early on before many school districts in the state did, and I think we've learned, Joe, that we probably, in the 21st century, we need to offer some sort of virtual platform in the future. And many of you may be familiar with this platform, the Blackboard platform. I know Angelo State University used it. I used it a little when I taught some courses there. So the public ed version of the Blackboard platform is what we call Schoology. So it's called a learning management system. So, if you look at the silver linings of COVID-19, although it's dire, there are a few silver linings, and that is it forced systems, good catch.
Wow.
Glad I wasn't talking to that camera, huh? So the learning management system, Schoology, so it has, the pandemic has forced systems to become digitally acute quickly. So we have done that, and then With Schoology, that allows us, if we need to, like, for example, the high school 9 through 12 that I mentioned, that on Fridays are going virtually, they're using the Schoology system. So they're not in our Edgenuity platform. They're in Schoology, which is a learning management system, much like Blackboard. It just allows you to move virtually quickly. So I think a couple of things that we did really well in San Angelo ISD was we did not put two platforms on the backs of our teachers. Because we worry about I read an interesting article and they labeled it the capacity surge for all citizens. So we certainly worried about the capacity surge and the emotional and social challenge of educating students in a global pandemic. So I think those things have worked well for us.
I have two more questions, actually one's kind of a follow-up. But the first one is, did we benchmark that from another school district or another state, or are we being benchmarked?
Many school districts, we utilize that from many of our, I've mentioned before that Texas School Alliance that we're part of, 41 districts in Texas that represent about 2.2 million students out of the 5.4 million students in Texas. We benchmarked it with Texas School Alliance and with many, of our tasks of the Administrators Association. So many school districts around the nation utilize it, and we also wanted to use it because it's congruent to many of our AP courses, advanced placement courses. A lot of virtual platforms didn't have some of the advanced placement courses, so we wanted students to stay on track and be able to have those advanced placement options in a virtual atmosphere as well. So that's one of the reasons we picked it. But it's tough. It's a hard and a robust system.
Finance-wise, you're looking at keeping this type of virtual platform after the pandemic is over? And what is going to be kind of like the strategic use for it? And does it lower the cost for the school budget, or is it increasing?
I
is it
think
neutral?
you would hope that it would be a wash because of your personnel units, and we average about we estimate about $60,000 for personnel unit with benefits for a teaching unit in SCISD. So you'd look at that, again, if you have 2,000 that are moving, or maybe post-pandemic, we may have 500 students that are moving to a virtual platform. I think you look at, your cost associated with that. You just move some of your classroom teachers to digital support teachers. I don't know if we would go back to Edgenuity or not, or if we would try to have time, because, we kind of had triage education from March till May. But if we have time to do it properly, I think we could probably use our own people and use Schoology, that platform, for even some of the advanced placement classes. So that's what I look forward to.
So you're looking at maybe cutting part of it, the full-time expensive part of it, but keeping the components
I think that's definitely a possibility. And we would push out another survey, post-pandemic or later in the spring to see who's still interested in a virtual platform.
Okay, school, district, and state budgets. Where are we at right now? I mean, obviously, I know that Mayor Gunter wants me to say this, that the school district consumes like the biggest, largest, most gigantic portion of our property taxes. And so are we getting more money from the state, less money? How are they counting our the students that are in class, those kinds of things? That's all been kind of like in flux.
So right now, they've kind of have completed a held harmless for school finance for this. It ran up to December, and I believe they've even extended that in the future. So school districts get paid on their average daily attendance, their ADA, by how many seats, how many students are in the seats. So they have estimated, I think maybe from 2017 and 2018, you'll have to fact check me a little on this, but it's close. They've estimated with a 2 or 3 year average and provided that daily attendance to school districts across the state, holding them harmless until we can, see where we are. Joe, you may remember I've made other comments that about most districts are running between 4 and 6% student loss across the state of Texas. And my hunch would be that that's nationally as well.
And so we're still in the hold harmless area, and we're still getting paid per student.
We are. And
when do you
with the legislative session coming up soon, I think we'll know more information, certainly.
Do you think it's going to continue into the next year, all 12 months? Or
what I understand,
let's say rest of the fiscal year.
There's probably individuals in this room that know more about this than I do, but our comptroller, our state comptroller, originally the estimations were were pretty large. In 2011, I think it was a $5.4 billion cut, reduction. Certainly school districts faced that. We faced that here in San Angelo in 2011. Had to, through attrition and through non-renewal, we had to lose about 100 positions school-wide here. So I understand that that was at $4.9 billion estimated earlier, maybe a couple of weeks ago. And he just had another statement, our state comptroller, I believe it was yesterday, but I would have to reread that article. So right now, I think we are preparing in SAISD to be fiscally conservative. In fact, we are putting a hold on many of our positions before we fill them. Because for a school district, most school districts in Texas run between 80 and 90% of their cost is in personnel. So for us, it's about 85% in San Angelo ISD of our $124 million budget is personnel. So the way you save money in a school district is through personnel reductions or attrition. You just don't fill those positions.
Going back to the question, the counting how many pupils are in the classroom may or may not happen because they might change the law, is what you're saying?
I'm guessing the state of Texas is going to have to recover billions of dollars some way. So I would anticipate there may be some reductions across the board. I think, we all saw that higher ed has suffered some of those reductions already earlier this year, as many other government entities have. Right now, they've left school districts alone, but we are preparing in SAISD to have some reductions. We just, hope they're not full.
How far is the San Angelo Central Bobcats going to go into the playoffs?
Well, let's see. State championship is what, 4th or 5th round?
Yeah, something like that.
So we anticipate playing the school for San Angelo Central from El Paso, which we all know. We heard earlier that El Paso is certainly a hotbed of COVID-19 right now, and Dr. Vretis has been there recently, I understand. So certainly there are people that know way more about that than I do. But I understand also that they are not allowing fans at their games in El Paso. However, I know our athletic director, Rodney Chan, is working on a neutral site to hopefully be able to have, maybe 10% attendance at a neutral site playoff game. That playoff game would be December 11th for the Bobcats.
That's all I have, sir. Thank you.
All right. Phew.
Further questions? All right, I just want to leave with one last comment, and just to remind everybody that the mayor of this city, the county judge of this city, Dr. Vretis, our public health doctor, have not ever closed any businesses. All business closures have been done by the governor. I still get many emails and text messages from citizens who believe I'm the one who shut the doors or Steve Floyd has shut the doors. We have not. The governor's orders are the ones who determine what happens in this community. But it is each and everyone's responsibility in this community to be a part of helping this community stay healthy, open, and financially stable. So we thank you ahead of time of being a part of our solution and part of making this community healthy and helping Shannon Health Systems take care of those who need their services. So thank you.